This is Dr. Jerry Hesch. I'm a physical therapist at Hesch Institute in Aurora, Colorado. And this is my client, Catherine, who has a long history of severe pelvic and abdominal and hip pain, low back pain, sacroiliac pain. And she's going to tell us briefly about her journey and her experience at Hesch Institute. And I discovered a pattern of the sacrum in which the sacrum can get stuck posteriorly in response to a fall on the buttocks. And this is what she presented with. Her sacrum was absolutely stuck, as was L5, the lowest lumbar vertebrae. And that creates a whole body compensation. And she responded very dramatically. And the pattern is named posterior glide sacral fixation. And I've posted a fair number of YouTube videos on that subject. And it's not understood because it's not in the writings. It's in the book that I wrote, and when I teach, it's in my, I teach it to other physical therapists when I teach workshops. And of course I have, again, a lot of YouTube videos on the subject, but it's not common knowledge. And I'd like her to tell us a little bit about her story and about her response to me restoring mobility in the sacrum. And I suggest that when someone has a sacrum stuck in posterior glide, it's stuck backwards, wedged, and it pulls on the pelvic floor. There's a constant increased tension on the pelvic floor, increased tension on the sacrotuberous and sacrospinous ligaments, and increased tension on the sacral nerves, especially the lower sacral nerves. And the treatment for that pattern takes 10 minutes, and it takes an applied force, and I've demonstrated that on the earlier videos. But it takes a little bit of time, a little bit of patience on the part of the therapist, but it's a one-time correction. And it would take a large passive force for her to undo the correction. So I'll let Catherine tell us a little bit about her history and her response to treatment.
Well, hello everybody. My name is Catherine Zielinski, and I want to just let you know that I'm thrilled to speak with you about the Hesch Institute. I had, as Jerry had mentioned, a very long road. I think we can track it back to a fall, maybe when I was around 25 years old. And I've just turned 49 this month. So I just want to give you a further history about myself. I've also had decades-long history of endometriosis, and I have had some surgeries in the past to try to help alleviate the pain from endometriosis. But the biggest thing was I still was a functioning adult. And what happened more recently is about 2 years ago I had a hysterectomy. And after that hysterectomy, it was a quite long surgery. It was 5.5 hours and a quite long recovery on the table, waiting for a hospital room, etc., etc. But seems to be just after that surgery, I was not able to pick myself up from a sitting position, and I seemed to become weaker and weaker in the pelvic floor. So a lot of it I attributed to was from the surgery, and I've been to many physicians and physical therapists, including urogynecologists, pelvic floor physical therapists. I've had injections. I've gone as far as New York City to some wonderful physicians at the Pelvic Floor Institute who did injections and plasma replacement therapy, which alleviated some of the pain. I've seen Dr. Clark in Chicago, who also had done some trigger point injections. I've gone as far as Australia to see a specialist who actually did diagnose me with sacroiliac joint dysfunction, and he referred me to a physical therapist in Australia who did some exercises, again, internally and externally. And I've gone to physical therapy for almost 2 years, but even the physical therapists are saying, what is this? We can't help you. You're still not able to sit for more than a few minutes. And then also get up from a sitting position was difficult. So some of the physical therapists did touch on Jerry Hesch's methods, and they seemed to work. One was my tailbone was pulled to the left, and they followed his method, and it worked perfectly after 5 minutes. And so I thought that Jerry Hesch was onto something, and I contacted him directly, and I wanted to go right to the source and have him take a look at my body and see what was going on to see if he could help me. So that was 2 days ago that I came to Colorado, and as Jerry had mentioned, he took a look at my spine and everything and to see what was in line and out of line, and he noticed that my sacrum was pulled backwards. As he mentioned, it really was 10 minutes of utilizing his method, and I got up and I walked like a different person. I actually feel a decade or two younger. The last 2 days I went about a really normal life, which I really didn't have for the last 2 years. I did quite a bit of shopping and walking and moving around and getting in and out of the car. And just after a 10-minute treatment 2 days ago, I feel like I've gotten my life back. And I can actually envision myself going on long road trips, hiking up hills, carrying my own handbag, taking in my own groceries. So what Jerry has done for me, I feel like has been amazing, and his methods actually work. It's not something that I would even have questions about. He knows what he's doing. It's almost sad to me that there aren't more physical therapists and doctors like him in the world that understand this pain and can fix it quite easily. So he's amazing. Thank you very much.
And thank you. And I'll just add a reminder that there are other videos on that pattern. And again, the pattern that you presented was a sacrum stuck backwards, purely backwards. And it's called Posterior Glide Sacrum Fixation. And it's a treatable pattern. And your walking is better now?
Correct.
And your sitting is better.
My sitting's amazing. Yes.
And your pain rating was what? What was your pain rating when you came, and what is it now?
It fluctuated between a 7 and a 9. 7 every day, though. Pain every day. Chronic pain for 2 years.
Okay.
I don't have chronic pain. My pain level now, I think everything's just getting used to itself. So I think it's fluctuating between a 0, 1, maybe 1.5.
I'll take it.
Yeah, me too.
Yeah, thank you for helping to spread the word on posterior glide sacrum fixation, a type of sacroiliac joint dysfunction.